from multiple locations. Anyway, my goodness. Well, welcome everyone on this rainy Friday in February. We're so excited to be sharing space with you again as part of our Health Innovation Community Partnership monthly meetings. We have a really robust set of speakers today, so we know there's going to be a lot of fabulous content and information for you. We gratefully welcome those who are able to join us here in person. We understand that's sometimes challenging with both traffic and weather. So we also are very grateful to have all of our participants joining us via Zoom today. We're going to make this the most interactive experience we can, which means we will be taking questions from the in-room audience as well as from our Zoom audience. Just a quick tech tips before we get started. As a note, this meeting is being recorded. The recording and all meeting materials will be posted to our HICPLA.org website in about a week's time. We do ask that if you are on the Zoom line, you go ahead and mute yourself unless you're speaking. And please make sure to take advantage of both raising your hand or typing questions into the chat. We definitely want to hear from you, and our speakers are here to respond to your questions and your points of interest. We also, our meeting is also being interpreted today in English, Spanish. If you're on the Zoom line, you can access that via the globe at the bottom of the screen. Alternatively, in the meeting room, you can pick up a headset at the front desk. Let's take a quick look at our agenda for the day. We're excited to, of course, kick things off as always with an update from the LA General Medical Center. Then we have a series of speakers who will be speaking with us about wildfire relief and resources as we help our community heal and become whole again after those tragedies. We'll take a quick networking break to give our interpreters a breather and give ourselves a chance to take advantage of the food and coffee and burritos and conchas that are in the room with us today. Then we'll hear from our Centennial Project partners, and we'll wrap up at the end of today's meeting with some Know Your Rights information about services and rights that are available to the immigrant communities in Los Angeles. And we'll end with partner announcements. So that is our full agenda. As you can tell, we have a lot to get through, so we will not waste any more time, and we'll dive right in. Before we begin, I do like to always start our meetings by reading off the guiding principles of the Health Innovation Community Partnership. All participants agree to basic principles prioritizing equity, community resilience, and health in all programs and projects. All participants agree to approach issues with an open mind, be willing to engage in dialogue, and commit to thinking boldly about solutions. Participants will state views and ask genuine questions. Participants will seek to avoid monologues and arguments, move to conversations where participants are curious and seek to understand various points of view. Participants will explain reasoning and intent, share how we reach our conclusions so that others can understand our divergent reasoning. Participants will attack the problem and not the person, organization, or institution. Participants will define key terms so that we can attain a shared understanding. Participants will share all relevant information. Participants will always arrive prepared for the meeting. During meetings, only one person speaks at a time. We will not engage in sidebar conversations. Participants will work to develop comprehensive, common set of information with which to solve problems and make decisions. Participants will jointly design next steps. And with that, I am delighted to welcome Dr. Josh Banerjee up to the microphone and the podium, who will be sharing with us updates from the Los Angeles General Medical Center. Josh.
Thank you, Heather. Good morning, everyone. My name is Josh Banerjee. I'm an urgent care physician here at LA General, and I work for our Chief Medical Officer, Brad Spellberg, as his Director of Transitions of Care. And I'm just incredibly excited and proud to be here today to share with you updates on our Safer at Home program. So I'm going to be sharing updates for you on our Safer at Home program. Is actually an LA General creation. So oftentimes we have speakers from our medical center who are sharing, what we're doing as well or better than, other hospitals across the country and the world. This is actually a new care model that was created by our medical center. So launch into the slides in a moment. All right, this is our Safer Home logo. We can next slide. So yeah, the key takeaways are we believe this is a first in nation model. It's really the vision of our chief medical officer and chief executive officer, Brad Spellberg and Jorge Orozco, with the support of our County Department of Health Services leadership, and really has engaged our entire medical center in advancing this care model forward. So we can move to the next slide. So the question is, why safer at home? And for those of you who might remember me, I first started working for Dr. Spellberg and came to HICP in 2018. And one of my introductory comments shared with you that my directive, which is actually the directive of this medical center, is to find ways where we can not only deliver world-class care here on campus, but find ways to push care and to spread care and deliver care to our patients and community at their homes and in the community. And so this has been, the impetus for this has been in process for a while. And there's been a recognition that, we provide truly wonderful life-saving care here at our hospital. We're level 1 trauma center, one of the busiest hospitals in the country. And we have an amazing team whose calling is to give patients their all, to give them the best experience they can possibly have when they are admitted in this hospital. And yet, right, try as we might, we all recognize that being in the hospital is a disruptive experience, right? You're away from your family. It's disorienting. You're away from your home. It can be confusing and scary. And acute care resources are limited, not just at this hospital, but every hospital. So the dual challenge has been, how do we, if at all possible, find ways to deliver care to patients that's the same as being in the hospital, but at home, thereby, freeing them from the experience of that hospitalization, but then also making sure that hospital bed is available for other patients who can only receive hospital in a facility. So that was the challenge that our leadership posed to us. And they asked our team here at LA General to create a program. So how does it work? What do we need? So we need to make this happen, right? To give patients to manage their acute illness at home, we really need several factors. First, we need a really fantastic team, right? A team that knows what is safe to treat at home and what truly needs to be treated on site in a medical facility. We need patience, right? And what we mean is we need to make sure that our patients understand what is involved and are willing and engaged and want this care model. Beyond the caregivers and patients, we need equipment, right? We need self-monitoring equipment. When patients receive care in the hospital, during the hospitalization, we're getting information about the patients through monitoring equipment that we need to now to be able to provide at home. We need transportation, because while we hope that we can deliver most, if not all, of the care virtually at home, we have to recognize that there might be cases where a patient's conditions worsens to the point where they need face-to-face on-site evaluation. And so we need to make sure that we can get our patients back in a timely fashion in a way that's convenient for them. And then finally, we need reliable phone access, right? Now, in this day and age, most will have access to a cell phone or a landline, but we want to make sure that phone access is completely reliable and we don't have to worry about service disruptions or, the capability to download certain apps. We want to make sure that we have completely reliable phone access to our patients and both ways, that the patients can reach us. So that's what we did. We gave our patients, we have a dedicated team. We developed very, very rigorous protocols in identifying who can benefit from this program and how to manage them. We give all patients at the time of discharge really, really tight education, careful education so that all patients leave understanding what they're going to need at home. And we give them all the home monitoring equipment. We give them transportation to and from the hospital every time we need them to come back. And importantly, and we're really excited about this, we give them a phone, a pre-programmed phone, right? So even if you have a cell phone and you love your cell phone, we have a special safer at home phone. You can consider it like the bat phone that goes directly to the care team member and allows patients to video, take pictures. So for example, if a wound is what we're watching, we can take pictures of the wound. They can text back and forth, and all securely, right? Privately, in a way that that we can partner in their care. And so how does this program work? Like, how did it do? Well, in the first year after launch in September 2022, it was pretty impressive. We enrolled nearly 1,000 patients. When you look at all the patients that we enrolled and compared them to those who otherwise would have received hospital care, who were enrolled in the hospital instead, we found that the patients enrolled in our program spent on average 4 fewer days in the hospital. That means we saved those patients by enrolling in the program 4 days of staying out of the hospital. For the medical center, that was about 3,500 days over the year, right? Those are 3,500 bed days that we were able to have patients stay at home as an alternative, but also made available for life-saving treatment for other patients that could only be treated in the hospital. We saved the system $6.3 million. We can talk more about how we calculated that. Importantly, nobody died at home or on the way back to the hospital, right? That's a never event. We would never want that to happen. And we proved that's the case, that, if patients needed to return back for hospital care, we were able to get them back to the hospital safely. And then the key outcome is that when we looked at the two cohorts, right, patients who were enrolled in our program versus those that were rigorously matched and received hospital care instead, there was no difference in their all-cause mortality after 30 days, or the chance of them needing to come back to the hospital. So we truly provided, fantastic care outside of the hospital virtually. This isn't just sort of our numbers as we're evaluating them or assessing them ourselves. We submitted them for peer review. So in healthcare, when you evaluate, a program or a process or a new intervention, you have to collect data very carefully, very rigorously, and then you submit it to a journal where other, physicians and nurses are reviewing your numbers to see if everything checks out and if this is impactful. And so we were proud to be published in a top impact journal in JAMA Network Open. You can see the top left article, and actually it was significant enough where they had an invited commentary on this in the same issue. And then a month later, there was also another article citing our work, that this is really, maybe we're on the vanguard of healthcare in the United States. We were recognized by the LA Times, which we were really proud about locally. We've also received national recognition. So National Association of Counties, America's Essential Hospitals, and Vizient all either gave us awards or featured us, in the case of Vizient, at their national symposium. Okay. We were actually honored to be visited by the Singapore Ministry of Health. So delegation from Singapore came to LA General to learn about this care model and how they might develop it or iterate on that in Singapore. So this is some photos from their visit to LA General Medical Center. And finally, that recognition is wonderful, right? But I think this probably meant the most to us. We were recently awarded 2 awards by the County of Los Angeles Productivity and Quality Commission. So this is a commission that awards programs, not just for hospitals, not just for the Department of Health Services, but across all departments in the county, and really, rigorously evaluates whether the programs that have applied are providing value to the people of Los Angeles, right? Because ultimately we serve the people of the county of Los Angeles and we are stewards of county resources. And so to receive both a top 10 award and a county image enhancement award from the Productivity and Quality Commission was really a big deal for us. But beyond these awards, and again, these make us really proud for all the hard work of our team, for the faith of our leadership and the vision of our leadership. These awards are great, and I mean, really make us proud. We hope they make you proud too. But for us, really, the most important has been our patient testimonials. This has been an incredibly rewarding program for all of us who work on it to be a part of. We have, when we deliver care in the clinic and the hospital, we're, sustained by these really fulfilling, life-changing interactions that we have with our patients. And it brings us such joy to hear our patients so happy and relieved to receive this care safely at home that can't tell you how much it means to our team. So we have actually a video of a patient testimonial. Actually, it was the same patient that was featured in the LA Times, and it also you'll see some of the faces and voices of our care team. So thank you. I mean, I hope we, you could see even like the smiles in our care team members. We really enjoy working in this program, and it's growing. We're enrolling more and more patients each day and offering a wider and wider range of services or a wider range of illnesses that we're able to treat at home. So yeah, we're really proud of this. Happy to share it with you. And if there are any questions, I'd be happy to take them at this time. Yes. Hi. Okay. Yeah, come on. Is my colleague, medical director of our urgent care, and well, the medical director of the Wellness Center, Dr. Carl.
Hi, everybody. I'm gonna make a quick comment because sometimes I think we don't understand always like what happens behind the scenes. And I have to say something about this particular program is that so many people are involved. It's actually made for a better physician because we have experts that are constantly having us think about if people need to be admitted, if they can stay safely at home. That's something that we really I would say that I put a lot more thought into that. So there's that. And then the guidelines as to what antibiotics we're using, which has so much data behind it. And, we know and confidently can say that we're doing the latest and greatest for our patients. And then I think the other part is some of these patients, because they're already they're fairly ill, they may not have engaged with the health system the way they were engaging before. So this program actually creates for a much more engaged patient, which in the end, I can really see that. I mean, you can see that they were writing in their sugars and their logs and they're checking every day. And there's so much data I think that's to come, but they're writing these things down and they're really engaged every day. So I think at the end, it makes us all better clinicians, better patients, better advocates all around. So I just wanted to stress that point.
So, okay, so I'm so glad you asked. What kind of illnesses? We have about 10 or 11 ones that we routinely take care for. So, one of the top ones are pyelonephritis, which is when you have a urinary tract infection that can rise up to your kidneys. Diabetic foot infections. So when you have diabetes, you're at risk for really bad infections that can threaten your, losing tissue in your foot, or can get into the bone. We treat that. We treat cellulitis, which is infections of the skin. We treat asthma and COPD exacerbations. We treat bacterial and viral pneumonias, so both bacterial and like influenza and COVID. We treat heart failure is another one. We've started treating multiple sclerosis exacerbations. And those are the ones where we have a set protocol. But the cool thing about this program is really anything that where doctor and patient think that, well, perhaps we might be able to do this at home instead, they present that to an on-call attending. So this program is 7 days a week, 365 days a year. So if someone's in the hospital and the care team thinks, we're really, the main criteria are, we think they're going to improve on treatment. Okay. There's an exceedingly low risk of them worsening fast. That's the biggest thing, right? Like if things are going to get worse, there's time to come back. Right. And then, that the patient's going to be going to a safe place with reliable phone access, which we can guarantee the phone access for everybody. So there are a number of conditions that we've been able to send home. We even sent home a patient with a pneumothorax, right, which is when you get air between the lung and the chest wall, and really, large ones need to be treated with chest tubes and need to stay in the hospital. But in this case, the patient was able to go home on a little bit of oxygen, and we could monitor to make sure it was resolving at home. So really, it's any, and the other thing too is we're always asking. So we have regular service chief meetings across, that my boss holds once a month. We're always asking, what else can we do for our patients at home? Yes.
Buenos días, mi nombre es Alejandro Castro y una pregunta.
Good morning. My name is Alejandro Castro, and I have a question. Maybe you already answered it. I'm not sure, but what are the communities that could benefit from this program, and if this program is going to extend further?
Yeah. So in terms of the so by communities, this was critically informed by our Patient Family Advisory Council here on campus, and actually a lot of the work that HICP have done. We're in the Wellness Center has been also a core partner from inception of the program. So a lot of the program features in terms of patient education and communication materials and modalities. That's all been actually developed and informed by by our Patient Family Advisory Council, by what we've learned from HICP, and by and through the Wellness Center. In terms of communities geographically or demographically, it's anyone who comes to our hospital, right? There's no eligibility criteria to what in terms of what kind of insurance you have, or whether you've been connected to care, or where you live in the county. None of that matters. Like if we can safely provide you care at home, we will do so. For patients that come to our hospital, and this happens not infrequently, who do have private insurance, right? Meaning somebody else is there's some other entities being paid to care for the patient. We still provide them the equipment bundle and the care at discharge, but as part of the process, we actually reconnect them with their home network so that they can get their follow-up care there. For patients that have not ever received care anywhere, we connect them to a provider, establish them. Oftentimes they're established here with us. And of course, patients who are established patients here, we reconnect them with our teammates here at LA General or across Department of Health Services. And then expanding the last question you're saying, are we expanding? Yes, we're always looking to expand. So both the number of conditions, number of patients that we serve, and we're even working with the other. Right now, this program is only live at Los Angeles General Hospital, but we've been working with Department of Health Services to see how we could expand to the other hospitals as well. You're welcome.
All right. Well, thank you so much, Josh, for sharing with us that fabulous update and that wonderful accolades to our medical center. What a phenomenal program. It's so exciting that you've been able to achieve so much with it. In the interest of time, we're going to have to keep moving right along. So give me one quick second to get my Zoom bearings about me. But I'm delighted to welcome up to the stage next. We have fabulous speaker, Jose Escobar from the Department of Public Health, who's going to be sharing with us some of the wildfire resources available through the Department of Public Health, as well as some of the guidelines for the department. So Jose, welcome so much to the Health Innovation Community Partnership. We are delighted to have you with us today. And I will get out of your way and you can just advance the slide with the arrow right there. Okay.
Sorry. Oh, right there.
Yeah, should be right there.
Okay,
Yes.
thank you. Thank you. Good morning, everyone. My name is Jose Escobar. I'm the Regional Health Officer for the San Gabriel Valley area, SPA 3, LA County Department of Public Health. I'm representing Kristen Mundy, who is the Regional Health Officer for SPA 4 and who's a member. I'm here, and I just want to start by saying that, for everyone or anyone who suffered a loss during this devastating time in the fires, my thoughts and prayers are with you and your loved ones. So, as many as you know, the community of Altadena experienced a devastating historic fire that began on January 7th, Tuesday, January 7th. The Eaton fire burned 14,000 acres in a span of 24 days. At the same time, the Palisades fire was devastating that community. These two main fires and other smaller fires created pollution, mainly air pollution, that drifted to several communities throughout the county. As a result, thousands of people were evacuated from both communities, Altadena and the Palisades community. In Altadena, there were 17 reported deaths, and over 9,500 structures were destroyed. On the deaths, I do want to say that people are still missing. So this count may, this number may increase in the coming weeks. I think many of you remember hearing or reading about what turned out to be a devastating windstorm that contributed to the rapid expansion of the fires in both communities, Altadena and Palisades. This is the warning that was issued the afternoon before the fire started in both communities, and you can see the warning of the whole area that was under warning for the destructive windstorms. And I'm sure, several of you experience those high winds during that time. Air quality usually remains a big concern after any wildfires that happen, both for those that are intimately affected, right, the people who are in the fire, and for those who live in other areas miles away. In addition, many people are who are affected by the fires directly or indirectly may also experience stress and anxiety and other emotional traumas due to the displacement and loss that they experience. Fire debris and ash bring toxic pollutants, including tiny particles that are present in the air and can be blown by the winds. And as I mentioned before, the winds were very strong during the time of the fires. So all these particles were blown into several communities across many miles from the initial fires. Anyone can be affected by these toxic pollutants, and those most at risk usually include seniors, pregnant people, outdoor workers, and those with pre-existing health conditions. On January 10th of this year, to minimize the health impact of the fire ash, debris, smoke, and particulate matter, the Department of Public Health issued a health officer order that prohibited the use of power air blowers such as leaf blowers. This health officer order was revised a couple of weeks ago on January 23rd to prohibit the use of such equipment, but this time within the perimeter of Altadena and Palisades. So in partnership with law enforcement and county fire and the fire department, public health participated in the distribution of personal protective equipments and education materials to anyone who was going back to their communities to check on their homes, to check on their communities. The PPEs included Tyvek coveralls, N95 masks, goggles, and gloves to reduce the risk of exposure to hazardous materials and toxins caused by the fires. Once the checkpoints were no longer in place on January 23rd, DPH established a resource distribution checkpoints to continue to provide these PPEs and educational materials to anyone who wanted them. So I visited both of the ones that we have in Altadena, and we may get a car with one person and, saying, I'm going back to my community. I want to be protected, but I also want to bring my family. So we give them as many PPEs as they need. And they may come once a week or they may come every day. And we always provide what they need. So that way, just because our goal is to make sure that they are safe whenever they return to their communities. In addition, the educational materials address precautions and steps that they can take to minimize the health risks when they enter the heavily damaged areas or that are destroyed by the wildfires. As of February 4th, over 17,000 people were served at the reentry checkpoints and the disaster resource centers that we also have available. As previously mentioned, air quality remains a big concern after a wildfire, and it is very important to check air quality index to ensure the proper precautions are taken to reduce the health risks. Here in LA County, air quality is measured by the South Coast Air Quality Management District, and I encourage everyone to visit aqmd.gov to view the air quality in your neighborhood. I live in Glendale, and I remember, just all the smoke and just the different warnings that, that I was receiving, and just checking the aqmd.gov, and it was red all the time, right? Because, at that time, the air quality was very, very poor. So when the AQI is high, it means that the air quality is poor due to the elevated pollutants that are contained in the fire. In the air. So some polluting particles called PM 2.5 are very small. They're so small that they can get deep into your lungs and even into your bloodstreams, and potentially can cause health issues. Larger particles, otherwise known as PM 10, can irritate your throat, eyes, and skin. These come from things like ash, burnt plants, and debris from buildings. Because AQI doesn't accurately capture the impact of larger pollutant particles like ash, it is important to also take precautions if you see ash or if you smell smoke, and when cleaning up fire debris and ash. So some of the precautions that we recommend people use whenever there's the air quality is poor after a fire, or when they're entering these areas where the fire destroy several properties, is wearing a respirator, an N95 or a P100 mask. These are specifically designed to filter out the PM 2.5 and the PM 10 particles, offering a high level of protection. In contrast, surgical masks or masks made out of cloth or bandanas do not provide the same level of protection, because they don't filter out those small particles that the N95 or that the P100 masks filter. It is also important to note that while the respirator masks are highly effective, they can be uncomfortable in wearing them, especially long time, or challenging for certain individuals. So what we recommend, if anyone has a pre-existing respiratory conditions or have difficulty breathing with the mask, is to talk to your healthcare provider for alternative protective measures that they can use. This may also include remaining inside and away from heavily polluted areas until the air quality improves. For those who can wear N95 masks, free N95 masks are still available at LA County libraries, at the disaster resource centers and the community resource fairs, and then also at the re-entry checkpoints that I mentioned a couple minutes ago. As people return to their neighborhoods that were badly damaged by the fires and homes near fire-ravaged areas, it's important to approach both entering these areas and the cleanup process with caution to protect your health. As I mentioned earlier, ash and debris from burned structures can contain hazardous materials, including heavy metals, asbestos, and toxic chemicals. The heavy metals such as lead and arsenic, it can come from burnt electronics and building materials, and even brief exposure can potentially cause skin irritation and potentially lead to more serious illness. The same is true of exposure to asbestos, which we know is found in older construction materials and has the risk of causing severe respiratory disease years after exposure. Because of this, if possible, it is best to consider delaying returning to burn areas until the EPA removes all hazardous waste products. Once back in your property, there are some simple precautions that you can take to reduce the risk of contaminating yourself with all the pollutants. What we recommend people is to wear durable gloves to handle debris safely, while we don't want anyone to be touching anything barehanded. Wear long sleeve pants and sturdy shoes to protect your skin. Avoid having fire debris and or ash come in contact with your skin. Avoid stirring up ash. So when cleaning, use wet wipes. Gentle sweeping and mopping with water are also advised. We don't want the ashes to come up in the air and then us breathing that again. And then also using a HEPA filter vacuum if needed. Seal ash in a plastic bag and place in covered bins to prevent it from being disturbed. And it is also best to keep children and pets away from these areas to avoid exposure and then ingestion of these ashes. a smoky smell in your house means that particles are still lingering in the furniture, in the carpets, and in the walls. And we recommend to clean surfaces with water and mild detergent. And then also to wash any curtains, anything that is made out of cloth, to also wash that. And using a HEPA air purifier and ventilate by running fans to clear odors and improve air circulation will also help with that smoke. If the smokiness, the smell continues after all of that has been done, the recommendation is to probably consult with a licensed and certified fire damage specialist, who have other resources or other ways to clean up, burn areas or anything that has been affected by smoke and ash. Taking these precautions is especially important for those living in or near burn areas where the ash has settled on surfaces and indoors and outdoors. Recommendations for people who garden. So wash produce well. We just recommend everyone, to wash this produce well under running water before cooking. You can also soak produce in a vinegar and water solution and also removing the outer leaves of leafy green vegetables. The road to recovery is it's going to be a long time, and we understand that people still have a lot of questions on when to return, when it's safe to return to their house, how to clean, and what to do to protect themselves and reduce the risk of anything that can cause any damage to their health. These are some additional resources to find information about the fire recovery efforts, where to get PPEs and other benefits. In DPH, we have our environmental health community line that is open 8 a.m. to 8 p.m. to answer any questions on other precautions to take when returning to areas affected by the fires. The two resource distribution sites that I mentioned before are still operational in the city, in the community of Altadena. One of them is in the parking lot of Grocery Outlet on Lake Avenue. And the second one is on Mundo Check Cashing parking lot, which is on Woodbury Road and the North Fair Oaks Boulevard. We also have a disaster recovery center that is located in Altadena. The disaster recovery centers is a one-stop shop, I want to call it, where several departments, LA County departments, are there to provide information on the services that they provide, and then also resources. FEMA is also there, so there's a county, state, and federal agencies and other nonprofit agencies are also there to provide assistance and services to anyone who need them. And I thank you, and I'll take any questions that you may have.
All right. And as Jose mentioned, it's not just the physical health, but the mental health as well. And our next presenter is from the Department of Mental Health. So I think we'll probably roll right into that presentation. Then we'll take some questions at the end related to either of the presentations, if that's all right. Okay. Oh, please. All right. So next up, we have Dr. Francisco Tan from the Department of Mental Health, who will be sharing with us some of the mental health resources available for those impacted by the fires. We've got this kind of holistic approach from the county resources that we're very excited to share with you today. Greetings, Dr. Tan. Delighted to have you with us.
Good morning, everybody. Thank you for having me. As you mentioned, my name is Francisco Tan. I'm from LA County Department of Mental Health, and I'm going to talk a little bit about the disaster mental health Eden Palisades fire. So what is the role of mental health in all this? We coordinate services with the outreach with the Office of Emergency Services and Management, respond to requests in real time. So we actually participated in many of the entry points, coordinate with other agencies, and provide mental health services, especially in disaster mental health. What is mental health? I think it's really important. Sometimes there's a lot of stigma in mental health. So mental health includes our emotional, psychological, and social well-being. It affects how we think, we feel, and act, and also helps determine how we handle stress. And a lot of the people that we see in these disaster places is that they have a lot of stress and they're very confused about what's going on. And sometimes they feel okay, but then, and then it hits them. So relating to others and making choices, we help them do that. And mental health is very important at every stage of the life process. Why is mental health important again? When people experience a disaster, they may experience a variety of reactions, many of which are natural responses to difficult situations, like signs of stress, confusion, physical or emotional symptoms. Individuals who suffer from mental health may experience exacerbation of existing condition. Providing mental health services will minimize negative outcomes. I mean, I was just recently in Pasadena, and when they hear something, it's just it's 30 times exacerbated, and that's why it's important to have somebody to talk to them and understand and comfort, and that's why we're there. So the role of mental health providers: assist survivors emotionally, provide support and guidance, assist survivors to cope with the events, and provide information and update on the situation. I think really is just just being there and providing support. We provide what's called psychological first aid, and I'm going to talk about it a little bit in a few seconds. Disaster mental health services. What is this? Department of Mental Health has trained clinicians and paraprofessional and peers who are able to provide what's called outreach and engagement. So we take our time. We want to make sure we get to know the person. We want to make sure that they're listened and heard. So we provide supportive counseling, which is a lot of listening to make sure that we normalize some of the common reactions that they're having as a result of their experience. Crisis stabilization, and again, the most important thing is psychological first aid, which is really a lot of listening, comforting, and connecting with the victims. That goes a long way. Listening goes a long way in these type of situations. That's why it's really important that there's people over there at the entry points that are able to listen, and that so that they can feel heard of what's going on with them. So again, what mental health services we provide: emotional support, assistance on getting needs met. We also provide what's called linkage to social and mental health services. So if they need mental health services, we're obviously going to try to link them to any resources that we know that will be able to help them. A lot of these are no cost, so we try to do that. We try to provide case management as well if that's what's needed, and we provide assistance in multiple entry points. As I mentioned to you before, we participated in this since the beginning. We had people in Pasadena, Altadena. We also have people in the Westwood Evacuation Center, Malibu, and all these other places. We're also participated in the Humane Evacuation Center for the animals. So all of those things we try to provide. But the main thing is for people to know that there's mental health services available out there, and that there's people that's going to be able to listen to them and support and comfort what's going on, and also link them to services if need be. That's pretty much the presentation for me, because I know I only have 5 minutes or so I want to make sure I leave some time for some questions.
Thank you so much, Dr. Tan. I'll invite Jose back up to the microphone and then see if anyone has questions for either of our speakers from Department of Mental Health or Department of Public Health about how the county is responding to those needs of our wildfire victims and communities.
I just have a comment about the first presentation. Thank you so much. I always think about also in terms of from the physician perspective, people knowing what kinds of exposures they've had. Sometimes we ask patients about their history and what have they lived through, and we learn that people maybe worked in open fires, and that's how they cooked when they were younger. So I would just encourage everyone to kind of remember these events, not just because we can't forget them because they're terrible, but also remember them as part of your medical history. And then the question that I have for Dr. Tan is, in these, are there any healing circles? We know that we have a shortage of mental health providers. Are there any healing circles where people that, just like our own family here that's here today can help support. And maybe we're not using the level of mental health expertise, but we're using people that are very in tune with the community. Is that such a thing?
Dr. Tan, I'm not sure if you heard the question. The question was about healing circles, if there are healing circles available to as a point of reference for people in the community.
My understanding is that there are many people out there that are willing to provide support. Please get in touch with me, and I can probably direct you to some of those people. But definitely, there's a lot of you can get in touch with me. I can actually give you some referrals if that's what you need, if that's something that you're. But there's plenty of support out there. I know that we provide some linkages to many people in regards to supportive counseling if they need more. There's other services out there. So please let me know, and I'll direct you to the right places.
Yes, thank you so much for that. I think we do have a need perhaps for that group healing opportunity, because so many people, I think so often they want to share their feelings and experiences with those who can truly relate. So I think that would be a wonderful set of resources, Dr. Tan. I'll follow up with you to see if we can get a list of things that might be in that general line that we could share out with our HICP membership. I also noticed we have a hand raised from Diego Rodriguez. Diego, please ask your question.
Thank you, Heather. Not a question, but just a quick reaction. Diego Rodriguez, CEO of Alma Family Services. Just want to start by thanking both of you, both presenters. The work done by DPH and DMH has been really outstanding. I'm an Altadena resident, so I have seen firsthand the dedication of the staff that is there and the care and compassion that they have shown to the residents. I just want to lift that in the chat. I'm sharing 2 resources. Heard of the need for healing circles and other wellness supports. Alma Family Services has launched a care center with services for individuals who have been impacted by the fire. Right here in Boyle Heights, we know that the impact has been far and wide. And at the care center, as you'll see in the chat, we're offering a number of tangible resources, but we are also offering wellness support, and that's funded through the Department of Mental Health. So thank you once again, Department of Mental Health, for the resources so we can help community. And we're being very sensitive that a lot of folks that have been impacted have mobility challenges and transportation issues. So we are providing remote services, including healing circles. We also provided in-person support, and we've been at different churches. We're connecting with school groups. So if you have any questions, the contact information is in the flyer. And we hope the HICP members can also share the information about the care center, where folks can get clothes, blankets, shoes, all kinds of tangibles, but also apply for financial aid and for grocery vouchers. So thank you.
Thank you so much, Diego. As always, we appreciate our partnership with Alma Family Services and, of course, your great love for this community. And if we don't have any more questions, we will thank our speakers, Dr. Tan and Dr. and Francisco, so much for joining us today. And then we'll move on to our next presentation. So I'm very excited to welcome Maggie Becerra to share with us some of the resources available related to the department. Pardon me, let's get straight here. Yes. Protecting us, in addition to our physical and mental health, there's also the concerns about kind of the economic well-being of people in this time of crisis. So we're delighted to have Maggie come share with us some of the resources and protections that are out there for the community related to price gouging. So Maggie, welcome so much to the Health Innovation Community Partnership. I'll let you take your presentation away now.
Appreciate it. Thank you so very much, everyone. And I think this is not only very timely with everything that's going on, but also, I think the alignment of this presentation right after Jose's, I think it will resonate with all of you. I mean, here you have Jose explaining about safety recommendations and cleanup, right? So us as humans, we start thinking, what do we need to put in place so that we're able to do what is being mentioned here, right? With that, then comes right behind it are scams. We try to do the right thing by our family, to ourselves, and to make sure that we are doing, as I said, right, the safety recommendations, the cleanup, and next thing you know, you get price gouged, or there are different scams that come into play. So it's not just the price gouging that happens, it's the scams and it's the fear factor that is set in, like that was mentioned, the smoke, and make sure you wear the proper gloves, the proper mask and whatnot. So you go to the store and what do you find? Oh my goodness, I can't afford this. This is so expensive. Or I just saw the price for this amount yesterday and now it's definitely have increased. So for this presentation, I'd like to present, what is price gouging? What is a declared emergency? What is covered? What products and services are covered by price gouging laws? And how to report suspected price gouging. So if you could hit the next slide, please. Thank you so very much. So one thing we want to make sure is that we don't get overcharged. We want to make sure that people are aware, that they're able to identify, and they are able to report. Next slide. So what is price gouging? Price gouging under California Penal Code 396, price gouging is the unlawful increase of consumer goods, right? Those goods like that mask, those goods like toilet paper, let's think of COVID, right? Services, the construction, you need somebody to come and clean up the smoke, the ashes, right? And those services, as example, they cannot be increased more than 10% following a declared state of emergency or a local emergency. The protections last 30 days following the state of emergency declaration, unless they are extended by the declaring authority. Next slide. So who is the declaring authority? Who makes the declaration? Sometimes we'll hear on the news, the president or the governor declared an emergency. Sometimes we'll hear the local board of supervisors declared an emergency. So a declaration by the president, governor, or by a local government agency, city, or county in response to an emergency. So for example, the Eaton fire, the Palisades fire, and it feels just like just yesterday, right? We went through the Palos Verdes and the bridge fire. Now here we are with the Eaton, Palisades, and Altadena. So anytime there's a declared emergency, price gouging is immediately in effect. Next slide, please. So what products and services are covered? As you could see here, we have, 3 bullet points, and we have some on the next slide. So California Penal Code of Consumer Foods and Goods and Services used for emergency. Think of an emergency. What happens? You have to clean up. You need supplies. You need home heating oil, housing, transportation, freight, and storage services. So for consumer goods would be any article that is used or intended for use as food or drinking. Repair or reconstruction services. Services performed by any person who is required to be licensed under the contractor state license law for repairs to residential or commercial property of any type that is damaged as a result of a disaster. Emergency supplies. As mentioned, it would be flashlights, radios, batteries, candles, blankets, soaps, diapers, toilet paper, right? Plywood, nails, hammers. Think of anything of an emergency supply. Next slide, please. Medical supplies. It could be prescription medicines, bandages, alcohol, right? Isopropyl alcohol. Building materials, I just mentioned, gasoline, transportation, and housing, I have to say, is probably the number one thing that's happening right now. All these houses have been burned, and there's no place for folks to go. So what happens, with a lot of things, us doing the right thing, trying to connect the dots, helping people, what happens on the other end? Scams, opportunity. opportunity comes up and, folks find opportunities to scam and make money off of declaring emergencies. So how much can businesses increase on prices? So a business cannot increase anything on goods and services for more than 10%. So there's a simple example. If something costs $10 and there's an increase of $1, an increase of greater than $1 could potentially be a violation of price gouging statutes. There are exceptions. If a business does increase a price of more than 10%, they must be able to provide proof that it was due to where they buy the products from, that the supplier has increased their prices, thereby they're passing that increase across. But we always tell consumers file a complaint with us because they're usually going to say, oh, well, we're having to pay that, so we're passing that cost to you. So we always ask consumers to file a complaint with us so that way let us investigate and see if in fact it was due to an increase of costs from their suppliers. Next slide. As mentioned, right, price gouging protections are in place for 30 days. They could be extended. As far as for contractor, they do last for 180 days. If you can go to the next slide, please. If you're looking to find information of what declarations have been in place by the governor, there's this link that's here is extremely useful to know if they've been extended and what declarations have been declared by the Office of Emergency Services, also known as CalEOS. So they respond and direct and coordinate state and federal resources and mutual aid assets across all regions of California. So please, I do highly recommend if you ever want to know what has been declared, if a declaration is still in place, that you familiarize yourself with this link to know what declarations have been declared by the governor's office. Next slide, please. As I mentioned earlier, price gouging on housing. That is, like I mentioned, are probably one of the worst thing that is happening right now. On January 7th, the California Governor Gavin Newsom declared a state of emergency due to obviously the Southern California fires. And as a result, price gouging protections, they are currently in effect, and these protections prohibit excessive price increases of rental housing during an emergency. These rental housing anti-price gouging protections will remain in effect. And this was with an executive order to extend it. This one is going to be in effect till March 8th of 2025, unless extended even further. Price gouging protections related to this state of emergency, landlords are prohibited from increasing rental housing prices by more than 10% of the previously charged or advertised price following a declaration of emergency. For rental housing not previously rented or advertised, the price cannot exceed 160% of the fair market value established by the U.S. Department of Housing and Urban Development. And for short-term rentals, because that is also a big problem that we're having, the short-term rental housing, such as like Airbnb and Vrbo listings, the daily price may not increase more than 10% following the declaration of emergency. If such properties were previously advertised or rented on a daily price, they cannot exceed 160% of the fair market value as established by the U.S. Department of Housing and Urban Development. A landlord may not justify an unlawful price increase by offering additional services, for example, such as, well, I had to increase it because it comes with a gardening or cleaning or utilities, or by offering a shorter lease or term. Similarly, a landlord cannot charge a higher rate simply because an insurance company and or tenant is willing to pay it. Additionally, the law considers it a separate misdemeanor for a landlord to evict a tenant and then re-rent the property at a rate prohibited by anti-price gouging statutes. And the state and local tenant protections remain in place, and in some instances may be more restrictive and protective than applicable price gouging protections. Can you go to the next slide? And So what are the penalties when it comes to violating these violations of price gouging statutes are subject to criminal prosecution that can result in a 1-year imprisonment in county jail or a fine up to $10,000. And violations are subject to civil enforcement actions, including civil penalties of up to $2,500 per violation, and injunctive relief and mandatory restitution. Can you go to the next slide? So how can DCBA help? So what is it that we're doing? So as of, I would say January 14th, I would say up to date, January 14th was just yesterday. I think we have 1,000, give or take 1,000 complaints averaging of price gouging. And I would say the main percentage is in regards to the increase of prices for housing. So when we get these complaints, what is it that we do? There are several things that we do. First of all, we notify the public of the declared emergency. We could do, it could be a mailing list. We do targeted posts through social media informing the public, not only the public, but also businesses. Obviously, this is information to the world out there. There's been a declared emergency. Please do not price gouge. Please do not scam consumers. So one of the things that we do is we track consumer pricing. So once immediately, sometimes we are aware of that there's going to be a declaration that's going to be put in place, or immediately right after, we start tracking consumer prices. So let's say we know toilet paper is going to be a problem. So we start doing price points on toilet paper. So then we have prices of what they were then and what they are now to be able to demonstrate that they have raised the prices. So similarly would be like housing. We start doing phone calls. We do proactive calls to businesses informing them, hey, we're DCBA. There was a declaration put in place. Protections include, housing, rentals, whatnot, and just letting you know so that please do not increase your prices. The law states that you cannot increase it for more than 10%. So please be aware. So we're not just, going out there to investigate. We are being proactive in educating businesses about the declared emergency. We definitely do accept price gouging complaints. We do investigate complaints, and we do work with a task force on price gouging. That includes Santa Monica, Pasadena, the DEA's office, the Attorney General, County Council, and we are the clearinghouse of all the complaints come through us, and we work with the price gouging task force to see, as we investigate these cases and refer them accordingly to the prosecuting agencies to be able to go after these bad businesses to, hopefully prosecute them for egregious violations. Let's see. And of course, on the last bullet, if applicable, we provide in-person services to local assistance centers. We are definitely at 2 of the disaster centers. We are there every single day, Monday through Saturday. We are providing in-service, in person at the West Side UCLA location, located at the Research Park West at 10850 West Pico Boulevard in Los Angeles. The same we have been originally in Pasadena. The Pasadena location moved to Altadena. We are there also Monday through Sunday. That is at the Altadena Disaster Recovery Center. And that one is located at 540 West Woodbury Road in Altadena. So for price gouging, we recommend consumers that you can either come in person, they can call our consumer protection line, but also they could file a complaint online. They can go directly to this link at the stoppricegouging.dcba.lacounty.gov. One of the things that we do ask consumers, one thing I want to mention is, the example that I mentioned about the toilet paper. So let's say you bought the toilet paper and now you go back and you're like, okay, first it was, let's say $5 and now it's 10. And you're like, well, I'm not going to buy it. You don't have to purchase it to file a complaint. If you have, let's say, a receipt from the previous purchase or a picture from the previous purchase, and now you have a receipt or a picture of the purchase that you are now making, or not making, take a picture and file a complaint with us. So we would need the business name and address, the product whose prices have been increased, the product prices before and after, and pictures of the prices, receipts if available. And as mentioned, you don't have to make that purchase to be able to show, the prior price and then the price of when the price was increased. And I would say that's probably what we're getting a lot of on the complaints for properties, people having images and whatnot of what a property was advertised in the beginning and what it's advertised after. And we, one of the things that we are doing in our department, we are notifying landlords and property management companies to please do the right thing. One, for awareness, and two, to do the right thing to make sure that, let's say they didn't or they didn't know, please do the right thing and not price gouge, especially on rentals. Right now on rentals and finding housing is really difficult for consumers. So we're here, to support our Angelinos, to support, our community, all of us working together. Please, any questions that you may have, refer consumers over to us to file a complaint on price gouging. And, one of the things that I also want to touch on is the scams. When Jose was talking about, cleaning, for example, like the cleanup, what we're starting to see here is remediation scams. So I can, go door to door and tell you to put fear in you that if you're exposed to these things, it could be damaging to you. Next thing you know, I'm having you sign a contract that, could be a scam, asking for upfront fees and things that, are a violation, unfair competition, misrepresentation. So with declared emergencies, not come only price gouging, but consumer scams. So please do refer any consumers to us. Please file a complaint with our department. Feel free to reach out and we'll be available to answer any questions. So thank you. Thank you, everyone. I appreciate it. Back to you. And if there's any questions.
Thank you so much, Maggie. Do we have any questions for Maggie on consumer protection?
¿Tenemos alguna pregunta
Hand in
para
the room,
Maggie?
We'll get that question for you.
Hello, good morning, everybody.
Muy buenos días a todos. Gracias, Maggie, por la presentación y por apoyar a nuestras comunidades, asegurándose de la protección. Mi pregunta es, hemos escuchado
properties are just coming into the market, right? That have not been previously listed maybe for a year, right? Is there any track of that data, and is DCBA engaging in any way with them to ensure that they don't come into the market with a really high price?
Correct. We are. I'm sorry. My apologies.
Oh, sorry, Maggie. You heard the question. Good. I was just wondering if you heard it. Okay, great.
That is correct. We're asking consumers to file a complaint so that way if they're saying it hasn't previously been, we are looking into these matters to ensure, was it really? I mean, a person could say, well, it wasn't previously advertised, right? So for investigations, we will do our research to see if it was previously advertised. We do work with county council and we have the ability to subpoena. So for us, we definitely would want consumers to file a complaint with us and give us the opportunity to see what exactly are they stating, right? Was it previously advertised? Was it not advertised? Was it advertised and then taken down and then the price, has changed? I would definitely ask consumers to file a complaint with us.
Do we have any other questions for Maggie? Well, thank you so much, Maggie. You provided a wealth of information. I know it's critical to know, not just for today's disaster, but for the future as well. You mentioned the COVID pandemic at the start of your talk. And I think all of these presentations today really speak about the county response in times of crisis. So today it's the wildfires and the communities affected there, but in the future, it may be different disasters affecting different communities. So with that, I will say thank you so much to our three wonderful panelists who came and presented to us today. Jose Escobar from the Department of Public Health, Dr. Tan from the Department of Mental Health, and Maggie Becerra from the Department of Consumer and Business Affairs. We're going to close out this section of our program, and we're going to take a brief 5-minute break so that our interpreters can take a deep breath. I encourage everyone to take advantage of the coffee and refreshments in the back of the room, and we'll be starting back again in 5 minutes. Thank you. Okay. Welcome back, everybody. We are going to turn the podium over to our colleagues at Centennial Partners, who will share with us some wonderful updates on the project's progress for the General Hospital and West Campus redevelopment. I'll turn it over to Giovanna.
Hi, good morning, everyone. I'm Giovanna Araújo. I'm project manager for the LA County General Hospital and West Campus Revitalization Project. I'm also here today with my colleague, David Abasta.
Hi, I'm David Abasta. I'm the Director of Development for Centennial and Prime Store Development.
So today we want to give some updates on the progress of this project definition phase process that we're currently undertaking, and give some updates, especially on challenges and opportunities that we're identifying throughout the campus. So we'll do a quick recap of our process, and then we'll jump right into our latest findings and some new information.
And I think just for context, we're going to be focusing on a particular focus area of our findings. This is a very in-depth process with lots of different variables. So right now we're going to be focusing on one particular aspect that Joanna will talk about, but obviously there's many more.
Yes. So just to give everyone an update, we continue to make a lot of progress in engaging with our various partners and having ongoing meetings to make sure that we're progressing in alignment with everyone's vision. So we continue to meet with our partners, HICP, our county partners, our campus project leads partners. And in addition to that, we're also participating in a series of town halls in various nearing neighborhoods so that we can give updates alongside the other project leads on all of the different projects and initiatives happening throughout the LA General Medical Center campus, all toward implementing this vision for a healthy village. So just a quick recap of our implementation timeline. We are on a 3-year exclusive negotiation agreement with the County of Los Angeles that includes 3 phases: the project definition phase, the master planning phase, and the project entitling phase, where we have to go through the process of legal approvals to implement on the various projects. So we're approaching now the master planning phase. Within the next 3 months, we'll be entering that phase, which is a very exciting one, and will feature a lot of community conversations around what ideas we want to see coming to life on the campus. Our process continues to be informed by these 3 key process pillars: the community needs that have been so thoughtfully and thoroughly expressed over many years of community engagement, all of the aspirations and the stressors and the priorities of the communities wants to see this project address, as well as government process, understanding the various policies that are in place that can support in really ensuring that this vision comes to life. Any site constraints, that's a lot of the work that we're doing right now in the project definition phase, is our due diligence process of understanding what is realistically viable and how can we get it there. And finally, economic viability, how can we come up with innovative funding mechanisms to bring these visions to reality? All toward a complete campus. This is a diagram that we've been sharing far and wide. It's a visual of the LA General Medical Center campus with the outline of what's our scope of boundary of our work, which is about 1/3 of the campus. But really, although our scope is 1/3 of the campus, we have to work very closely with all other representatives throughout the campus so that any ideas are really cohesive and support all initiatives and create something that's very nice and unified. We're grateful to LA County and our HICP partners for having thoughtfully transferred so much information to us about the previous community engagement process. So our goal with these meetings here with HICP is really to give information about how we're taking these priorities that the community has expressed and thinking about them as we think through the project. And so right now we're giving presentations on challenges and opportunities that we're encountering on the project, and the community engagement continues to build upon itself. So we're never really asking the same questions or presenting the same content. Now it's challenges and opportunities, and soon we'll be talking about designs and ideas and things of the sort. So in the 5 priorities, all of the community priorities were organized in partnership with the county and HICP into 5 key priorities: campus infrastructure, community spaces, affordable housing, economic anchors, and supportive services. There's a lot of different topics covered within these 5 key priorities. So to make sure that we're sharing information about how we're thinking through all of them in bite-sized pieces, at every HICP presentation, we're focusing on one specific topic. So last presentation, we talked about campus infrastructure and how we're thinking through utilities and ideas around energy and sustainability. Today, we're going to talk about community spaces, more specifically open spaces. There's 2 types of community spaces: open, which is anything that's outdoor, green spaces, parks, walkability, and then closed community spaces, which are interior spaces for us to have community gatherings, for us to really pay homage to local history and things of the sort. So today we'll talk about open spaces and everything that we're thinking through to come up with some innovative solutions here.
When we think about community open space integration, we looked at the 2 kind of key challenges, as we've done a ton of walking, researching, analysis, architects, landscape architects, civil engineers, community members, stakeholders. They really focus on 2 themes of the campus. This is thinking out the outdoor components of the campus, again, as Joanna mentioned. Really, there's a significant fragmentation of the open spaces that exist today. Separate and apart from whether they're sufficient or meet the community's needs, they're very fragmented. There's a lack of vegetation diversity, and in general, there is not a coherent open space on the campus. Some great spaces, clearly, but just a big fragmentation there. And the other big challenge we've identified in this channel is the poor walkability of the campus. Some of that is related to the topography of the campus. There's a big hill, there's big structures, there's distances between things. It's somewhat confusing to get around the campus. It's hard to get from point A to point B without knowing it. And just generally the steep topography, limited connectivity, limited routing that currently exists between different parts of the campus really limit its ability to function as a coherent whole. So those are the 2 kind of key open space integration challenges that we've arrived at as our areas of focus as we develop plans for an open space proposal.
Yeah, so when we are thinking through the campus holistically, we also have to think about what's happening beyond the campus that informs the overall biodiversity of the campus and makeup of the campus lands. So one of the things that we've studied thoroughly is hydrology patterns in the region. There is a hydrology path that cuts across the campus that's currently an underground creek. And that is currently taking stormwater runoff to the LA River. So those are some of the things that we need to think about. Okay, how does the campus connect to this greater infrastructure in the area? And how can we think about remediating some of this biodiversity?
And associated with that is a sort of need to focus on stormwater management and thinking of that as both an opportunity and also just a requirement. There's a lot of infrastructure that currently manages the stormwater based on the current conditions. It is dated. It does not necessarily meet what would be today code standards, but also in the reality, there's going to be significant water flow redistribution as a redevelopment of the campus sort of develops over time. And so thinking holistically of stormwater management and how it integrates to both regional goals and specific goals of this project is very important. Again, that natural creek path is a sort of beacon to us about thinking about not necessarily fighting nature, but working with nature to deal with the hydrology. But obviously, we're going to be using the most innovative sort of techniques, technologies, systems, a combination of natural systems, percolation where it's appropriate, and detention and catchment where necessary as well. So really thinking about stormwater management as a sort of integral part, although we're not really here to talk about open spaces, but if you guys think about open space, the stormwater management element of it is both an opportunity and a challenge and a sort of element of the open space planning.
Yes, and also the campus has some really significant topographical changes. So State Street, for instance, bisects the site with significant elevation changes. So right in front of General Hospital to the rest of the campus, there's a very dramatic slope. And that makes it very difficult to think through walkability. So we're having to come up with some ideas of, we don't want to see a bunch of staircases, right, connecting the campus. That's really uncomfortable for the daily users. What can we do that makes that those transitions less dramatic and much more comfortable and seamless and interesting, and that there's potentially open spaces along the way that make it inviting and make it more an experience. And so a lot of the slopes on the campus, they exceed the thresholds that are safe for American Disability Act. So that's also something that we're trying to be really responsive to, and we'll have to design for.
Another topic that has come up in this analysis is themes around circulation and connectivity. There's a lot of dead ends, a lot of lack of connectivity and making a navigation that's inefficient because of security concerns, because of operational constraints. The campus is just simply very fragmented. It's, which gates are open when you can park where, all that stuff kind of, as you all know that live here and work and live it here and all that stuff and challenged here. No, there's a lot of dead ends. There's a lot of navigation. There's a lot of overlapping infrastructure and conflicting uses, loading happening in places where people are like parking their car and things like that. The grade changes and all that as described really limit that connectivity, but also limit the ability to create a dynamic space. So we're going to be looking at a lot of different alternatives to embracing that grade change in a way that actually creates a really exciting dynamic open space. Looking to some lessons from history on that as well, I think, as we go through this. And then the other last bit is that the gathering spaces are hard to reach and lack foot traffic or engagement. Where there are open spaces today, they're often sort of ancillary to the side from where people are going. People have to know they're going there. I mean, not all of them. There's some great ones, as we all know, but there's also just a general kind of, they're not easily accessible, and they're certainly not accessible by the community. So as we look at connectivity to the broader community, that's another big element for us. We're part of a neighborhood. We're part of a community beyond the campus itself. And so thinking about how we connect to the open spaces and to the community members, whether that's the adjoining immediate neighborhood and also the broader immediate neighborhoods, that there's a good connectivity that makes this an inviting space for all.
Yes, and so we've mapped out all of the existing open space areas and really did a lot of work to understand the current pedestrian circulation patterns, so that the whatever new designs that we begin to play around with and consider are not going to be disruptive of what's already an existing pattern. They are actually going to embrace and just reinforce and improve those patterns and facilitate that daily experience much more. Identify any gaps, bridge those gaps, right? And also that's an opportunity to bring a lot of native landscaping as well and think about overall remediation of the landscape. We found that the landscape right now doesn't really feature a lot of diversity, but there's also that opportunity to bring back the native land as much as possible.
And just to kind of piggyback on that, there's been a lot of talk around the amount of concrete and heat island effects and the lack of shade around the campus. Obviously, right now we're in rainy kind of California winter, but summertime, this is a pretty unforgiving site in terms of heat and shade. And so that's an important focus area that we've looked at, and like understanding where shade is today and where it could be and where it might be necessary. And as Giovanna said, focusing a lot on native vegetation and also just low water vegetation. There's obviously a balancing act there with maintenance and things like that. But obviously, again, embracing that nature aspect of what wants to be here and really celebrating that and using that to advance the sustainability goals, but also the soil control, erosion, stormwater, all those different things in a sort of holistic fashion.
Just a little bit more, one of the things that we did is understanding also the existing tree canopy, and what are some of the trees that have already been here on the campus for a long time, and how do we preserve them? And how do we bring new trees and new vegetation that supports already what's currently existing?
And so again, going back to the challenges, we think about challenges as having their other side of the coin, which is the opportunities. So we see some opportunities to connect to adjacent green spaces, for example, Hazards Park, Lincoln Park, et cetera, regionally. We think the topography actually gives us some interesting opportunities to do some innovative things around stormwater management and water management overall. So that can be a really helpful and interesting tactic in terms of how we fix some of the topography changes combined with stormwater management techniques. And really the opportunity to create healing and inviting spaces for walking, gardening, and pop-up events, a variety of passive and active recreation as expressed by the community, vision of the project and as embodied in the healthy campus theme that drives everything we do here. So we ask ourselves, how can you create the campus through green spaces and pedestrian-friendly design? That's kind of the driving question as we move through a master plan and detailed planning exercises, circulation elements, long-term plans, short-term plans, interim conditions that'll exist in the short run versus long run, impacts to the current users of the campus, if and when construction proceeds on various elements, and making sure that this is all being thought of holistically and not just haphazardly on a one-off small project basis, but thinking about it as a campus. Again, pedestrian friendliness, integrated open spaces being the themes that are coming out of this exploration. There's some examples here of things like public parks with recreation for all ages, things like furniture and gaming, lights and plants. These things drive activation, drive foot traffic, and therefore drive safety and security. So that's a big important element of this that sort of also permeates this process, is thinking about safety and security and connectivity as a part of safety. And then also for all the visitors, residents, people who work here, people who make their living here, vendors, et cetera. Safe connection to the neighborhoods, clear, efficient, modernized wayfinding that is responsive to various things. Thinking about wayfinding that, for instance, we all navigate to these HICP meetings, wayfinding that sort of makes it very easy to find where the different events are happening, large and small, in a sort of cohesive fashion. I think we've got some great tools with technology to do that. We've also looked at county-aligned programs that will help facilitate that and also will help guide our policy decisions around these topics. Things like the LA County Safe Water Program, the LA County Sustainability Plan, and the Climate Vulnerability Assessment are very much incorporated into our analysis and design. There's a lot of work that's been done by our great county partners on that process, and really just highlighting that we've spent a significant time going through those documents and both understanding the opportunities, the mandates, and the ambitions of those programs, and how we can sort of connect the work we're doing to those efforts.
So we're excited to have continued dialogue. We know this is a lot of information and we want to have the chance to hear from all of you. We're excited for the questions at the end of this as well. But in addition to that, we have created a little survey, just 2 questions, just to spark some thought and conversation. Which nearby open spaces should the campus be connected to and why? And in what ways could improving campus accessibility better support the mission and activities of entities on the campus and in the surrounding area? And then just any other additional thoughts. We're very open to conversations at all time. We have an office at General Hospital, always a reminder that we have open visit hours, and are happy to welcome you. Thank you so much.
Great. Thank you guys so much. So do we have questions for our Centennial partners? We are running a little late on time, so I'm going to ask everyone to keep their questions very tight if we have them. Alejandro has a question.
Buenos días de nuevo, Alejandro Castro, para servirles. La
This is
pregunta
Alejandro
es,
Castro here. My question is, I want to know if Metro can support to help with the traffic that this would cause.
Yeah, the question was around what role can Metro play in helping with traffic and access and access and just general circulation on the site. I think it's an important topic. We're actually actively engaged with Metro. We've scheduled various meetings with them. There's various initiatives on both short-term Metro plans and long-term visioning surrounding things like both transit corridors and potentially more permanent, larger infrastructure. And so that's the to answer your question, a big role. I think there's always the world right now of limitation of resources that plays into this, and that's an important part of it. But so really thinking about transit as a part of central, I mean, so much of the population that visits this campus is uses transit. And so the current transit environment, while there are a lot of bus lines that come here and stuff like that, it's not necessarily the most welcoming and integrated kind of process. And so really thinking about how we integrate transit into the long run sort of vision of the campus is absolutely a part of everything we're doing on the site. So Metro is going to play a big role in this. There's a lot of people in the room helping us with this process together jointly.
Yeah, great question, Alejandro. And we were all just in a meeting actually with Metro earlier this week to talk about some of those integrations in terms of light rail and things like that. So it's definitely part of the Centennial Project and part of the larger initiative around this campus to make sure it's more deeply connected and accessible via public transportation. Do we have additional questions? Okay, hearing none because you guys do such a wonderful job going so deeply into it. Please know that you can reach out to our partners at Centennial via the survey tool or via office hours here on site at LA General. And of course, they'll be joining us bi-monthly to continuously provide these updates. So if you have questions as we go, this is definitely the marathon, not the sprint. So there will be many opportunities in the future as the project continues to evolve. So thank you so much, David and Giovanna. All right. We are moving into the final stretch of our program today. We're so excited to have some guest speakers with us to speak about Know Your Rights. We know that this is a emerging and very timely topic for the community. So we're delighted to have guest speakers joining us from Public Counsel as well as from the Office of Immigrant Affairs. So with that, I'm going to move on to the presentation slide. Give me, again, 1 minute to get myself there. But I am very excited to welcome Cassidy Bennett and Raymond Fang from Public Counsel, who will be telling us a little bit about Know Your Rights from a small business and nonprofit point of view. Cassidy and Raymond, welcome.
Thank you. Hello, everybody. I'm Cassidy Bennett. My pronouns are she, her. I am a staff attorney at Public Counsel with our Community Development Project team, and I will pass it to my colleague, Raymond.
Nice to meet everyone. My name is Raymond Fong. I'm also an attorney in the Community Development Project at Public Counsel. Nice to meet everyone. So today we'll be discussing, we have a longer version of this presentation with slides that will be shared afterwards. Today we're just going to do a very, the Cliff Notes version of some very basic Know Your Rights for interactions with immigration enforcement for your organizations. We know folks are scared and confused given potential threats from the Trump administration. And so we want to make sure that folks who have physical office spaces understand what their rights and responsibilities are if ICE appears. We will kind of just give a broad overview, and we have a longer recording available for free online for your viewing, as well as a set of slides and an FAQ with a sample policy for your organization. But yeah, let's get into it. So next slide, please. Okay, so as a disclaimer again, so this presentation is intended as a general overview and is for informational purposes. So this presentation should not be construed as all-inclusive, nor does it constitute legal services or legal advice to any individual or entity. So attending this presentation does not create any attorney-client relationship. If your organization would like specific information about how you can develop your own ICE response policy, you can fill out our free online application for legal services for nonprofits from Public Counsel, which is available online, and we will evaluate, if we can provide personalized assistance to you. Okay, so first, in terms of preparation, you have to so before ICE even steps in the door, what are steps you can take to make sure your organization is protecting your clients? So first, you want to consider what information your organization has on file. You don't store data unless you have to for a specific purpose. So think through, what client and member information do you currently keep on file, and consider whether you even need to ask for that information in the first place. So, if you do need to ask for this information, do you need to keep it on file? And if you do need to keep it on file, how long do you need to keep it for? So all the data that you store can potentially be provided to law enforcement or ICE if they have proper documentation to ask for it, which is something we will talk about what that looks like later. But because of that, we recommend you do not store sensitive information like social security numbers or ITINs if you don't really need it. And so think about whether there's an alternative you could use instead of more sensitive information. So instead of asking for a passport or residency status, could you use a utility bill or a lease instead? So if there's not a business need to keep or ask for certain information, it may be best not to do so. And so you should also think about online retention versus physical files. So digital can provide many benefits. You can encrypt the data, you can hide it behind a password, you can, keep it stored online versus a physical document, which may be more easily accessed by law enforcement. And so finally, consider whether you have written policies that cover the retention and disclosure of client and customer information. It's a good practice to develop one if you don't have one, so that staff and employees have a good understanding of the importance of, not collecting certain information. Next slide, please. The other thing we want you to know, this is again before ICE even steps in the door, is the difference between public and private space. This is important to distinguish because ICE can enter public areas of your business or workplace without your permission. But in non-public areas or private spaces, then they need a warrant to enter those spaces and search. Non-public areas under the law are defined as areas where you have a reasonable expectation of privacy. And there's two standards that this is analyzed under, subjective and objective. But generally, you want to make sure, areas are clearly marked as private, where you can put a sign that says no entry without authorization. And so for these areas, the officers need a warrant to enter unless there's some sort of exception. So public areas are open to the public. This is like a reception or a waiting area. So entry by the officers into these areas is not a trespassery or illegal search, and no warrant is required. It's good to think about knowing where ICE can even go and not go, when they step in the door. Next slide, please. So what does immigration enforcement look like? So ICE stands for Immigration and Customs Enforcement. So ICE is the agency you hear about the most, but there are a few more you should know about, all of which are immigration enforcement and all of which are within the US Department of Homeland Security. We'll just use ICE during this presentation synonymously with these other agencies, even if that's not the exact subsect of the Department of Homeland Security that you would be interacting with. So there's also Homeland Security Investigations, which does a lot of the workplace enforcement operations. They oversee international students and they conduct transnational criminal investigations into things like financial crime, human trafficking, and narcotics. So you'll see their logo in the bottom right here. HSI has been the group doing these large workplace raids. There's also ICE, which is enforcement and removal operations, which work to arrest and deport individuals. And then there's also, you might also heard of USCIS, which is US Citizenship and Immigration Services. So they process visa applications, but they don't do immigration enforcement. The third agency is Customs and Border Patrol. So they're the folks who do immigration enforcement at ports of entry and airports and within 100 miles of the border. So ICE, if your office is within 100 miles of the U.S. border, Customs and Border Patrol can be active. If you're more in the interior of the country, ICE is responsible for that enforcement. Regardless of which agency comes to your door, enforcement, they're all trained to identify themselves as police when you ask. So you need to, make sure you identify the logos on their jackets and ask them to directly identify themselves. And so the next slide will show an example of what ICE credentials look like. It can take the form of a business card or a badge. So, it may say ICE, it may say Homeland Security Investigations, it may say Customs and Border Patrol, but all of those are authorized to enforce immigration law. So, if you are a secretarial staff or front desk staff and ICE comes into your office, shows your ID, you have general rights with respect to immigration enforcement. You have the right to stay silent. You have the right to ask for identification. You have the right to document and record. And you have the right to deny entry into private spaces if there is no warrant. And you have the right to ask for a copy of the supporting documentation. So you have a right to see the warrant. In reality, it could be hard to exercise these rights. ICE agents are trained to use a command voice to intimidate people, and they enter interactions thinking they could be in dangerous situations. But this is why it's good to have a policy, which we'll discuss later. And so, why have a written policy? So this is a useful tool for training staff on both how to protect your clients and your organization's legal rights in the event of an immigration enforcement activity at your office. It encourages discussion and agreement within the organization, and it reassures staff of their protections. So, this is a great preparatory tool that you can use to make sure all of the front desk staff are comfortable knowing what to do if immigration enforcement shows up, and knowing what the proper procedures are for how to engage with them if and when that does occur. So with that, I'll pass it to my colleague Cassidy to talk about, everything so far has just been about preparations. Now Cassidy will just give an overview of what to do if and when they come to the door.
Thank you, Raymond. Yeah, so as Raymond said, this written policy is really helpful so that you're ready if this happens. One thing that you want to have in that policy is an authorized person. That person is someone who is comfortable reviewing a warrant or talking directly to ICE, has a little bit more preparation or background availability to speak to them and understand what they're coming from and how to direct them. So if you're the person who's greeting them at the door, first, stay calm, don't run, and contact that authorized person. Again, that written policy is going to be really helpful so that your staff is able to know who that person is and feel more calm and ready to approach this situation. You can inform them that they don't have permission to enter any authorized space. You can ask them to stay in a designated area. If they're outside, if you have like a buzzing system that doesn't even allow people in your front door before they come in, you can ask them to stay outside, and the authorized person can go out to meet them outside. The authorized person should then inspect any documentation that they do have. If they have nothing, you can state, we have a policy of denying access without a valid warrant. Then, if they do have a valid warrant, that authorized person or another staff member will take time to double check that warrant. Again, this is something I'll go over very briefly here, but in our longer slide show and presentation, we have a lot more information about what different kinds of warrants they can bring and what those different warrants allow. So if it's valid and you do need to let them in, the authorized staff member can help them with the authorized search by basically just making sure they remain in the bounds of what they are specifically authorized to search and not letting them into any other areas. You do not have to support their search in any way. You don't have to identify any of your staff, any of your clients, or anything like that. All that you would do in accompanying them is making sure that they don't go into areas that they're not allowed to enter. Okay, next slide, please. Thank you. So this is an example of some of the warrants that you might see. And again, something that we would need to go over much more in depth and that we have a little bit more information on. But there are different kinds of warrants. There are judicial warrants, there are ICE-specific warrants, there are arrest warrants, there are search warrants. These can all mean very different things for which areas they're allowed to enter, if they're allowed to enter at all, and what that might mean for your organization. So again, why it's really helpful to have someone who is authorized to review them, be prepared for that. All right, next slide. So again, this is for your non-authorized on-site staff. Make sure that you know who that staff member is, and then you can say, I'm not authorized to speak. I'll contact our authorized staff member. And you can even practice these phrases. We have more key phrases on our next slide too that I'll talk about, but you can say, I do not consent to your entry, so that you feel prepared to say that to any enforcement agency when they arrive. Again, like Raymond mentioned, they are trained to have these enforcement voices that you want to have a little preparation to be ready to stand up against those. Don't provide documentations or information, but don't physically interfere. Don't make false statements or obstruct them, and just don't engage in any unnecessary conversation. Use your key phrases and then stop and wait. You can direct your clients, or if anybody, like if you have a waiting area, you can direct people in that area and say, you have a right to remain silent and you don't have to answer questions. However, you cannot say, don't speak with that person. So you kind of have to have that balance of what you say and how you provide that information. We also suggest that you document the interaction, record it with your phone, if you feel comfortable with that. We'll talk about that in a second. Let's go to the next one. So key phrases, we don't have time to practice them right now, but we really do suggest that you practice these, say them, feel comfortable that if they come, you have things that you're ready to say. You can even have these written out on a document in your written policy next to the person who might engage with them. One question I want to highlight is, do you have a warrant? Please pass it under the door. So that's something you can do too. Again, remember that you don't have to let them in if you have like a buzzing system that doesn't allow public entry. And so if they have a warrant, they can pass it under the door so you can inspect it, or the authorized person can go outside. Okay, next slide. Yes, documentation tips. If you're going to record with your phone, announce you're making your recording. This is especially important in California, but say, I'm going to be recording you now. Stay away from them. And as much as possible, just record the agents. Don't record your staff or your own clients. Document written as well. What date and time is it? How many of them were there? Can you get their names and their badge numbers? Raymond showed you credentials. Take photos of those. Did they say who they were? And what did they say they were doing there? Did they present the warrant? Talk about everything that you can remember. And we recommend that if you're going to be writing this down, not while it's happening, write it down as soon as possible after it happens. Okay, so I know that was so much information and really, really fast, and a lot of information was missing. So we want to make sure that you all have access to our additional resources. I shared a bunch of stuff in the Zoom chat as well, and Heather has it also, so it'll be with the HICP resources from this meeting. But we have a full document FAQ that goes over nonprofit and small business rights with respect to ICE. And if you go to the next slide, we have a Spanish version as well. So both those links and PDFs are available for download. And then if you go to our next two slides, this is the full presentation that we talked about. This was like a quick 15 minutes. We have a full hour and a half that goes over all of this and really in depth talks about I-9s as well. So this is also in both Spanish and English on our YouTube site. It's unlisted, so you have to go through the links. So you can access those through the HICP resources or through us directly as well if you need. And then our last slide is just additional resources that we want to share with everybody. Again, we know this is really scary and can feel really overwhelming, and we're hoping to try and make it just help you feel as prepared as possible for what might happen. Okay, sorry for moving through that so fast, but thank you, everybody.
Thank you so much, Raymond and Cassidy. We really appreciate all of that resource and, of course, the access to the videos and other things that we can bring back to our individual organizations and try to, kind of educate our staff so that we're ready to go. We do have one more presentation to just ahead of us, but I see Rosa's coming up to say something.
Just appreciating public counsel and all of the attorneys that are working so diligently to get us this information as quickly as possible. I know with the county, we've also, been waiting to receive information about how county facilities function. So I know Rigo's up next, but I do want to share, because I know Jorge Orozco wasn't here this morning as our CEO, but we have been hearing from him the importance of continuing to stay safe, continuing to be informed, but also please know the hospital is open for everyone, regardless of our ability to pay or our immigration status. And so please, as you're talking to your family and friends, please let them know that our hospital is here just like they've been always, and they will be protecting patient rights and confidentiality and addressing things when they do need to be addressed in confidential spaces so that patient care areas aren't affected. And so it's important that, we just continue to become informed. And so again, just public counsel, thank you. NLSLA is in the room today. Thank you. They're working really hard. If it wasn't for organizations like yours, I think it would be so much more difficult for us to get information out into our community. So thank you guys so much. And I'll hand it over to Rigo.
Thank you. Thank you, Rosa. Good morning, all. Can you see my slides?
Yep, definitely.
Awesome. Rosa and everyone else, thank you so much for the invitation. I'm not going to take too long in case there are a question or two. Just wanted to quickly give you sort of an overview of what's going on, what's causing all the anxiety. Rosa, you mentioned making sure that our communities get the right information in a timely, clear, factual manner. I know that the fear has created a lot of anxiety. We have received a number of reports where our communities are reacting to what they think is some immigration raid going on. At least for now, we have not been able to confirm any random enforcement situations that we have responded to and checked have all been targeted. In situations to a specific individual, something that, as you know, ICE has been doing for forever. So we really want to make sure that, again, the community is not overreacting, that they are not disengaging and letting the fear get in between receiving the support service they or their families need. So I'm like I said, I'm going to spend a few minutes here. I wanted to just quickly, introduce you, those of you who don't know, our Office of Immigrant Affairs in the Department of Consumer and Business Affairs. We're basically the door for immigrants and their families to knowing what county support services we have, and really making sure that there is capacity for us to help our communities. A lot of the work we are doing has to do with the outreach and education, ensuring that we support our departments with language access capacity, the immigration lens in terms of the fears and concerns, and in many cases, even culturally, how do we make sure that working with our partners, we connect in an effective manner. But just to frame this whole anxiety and discussion that is going on And this is just compounded by the wildfire disasters. As you know, a number of executive orders, actions, memos, and things have been coming down from Washington. And it is really all encompassing in terms of how our communities are being impacted. Here is just a list of some headlines. I'm not going to go into detail about any of them, but just suffice to say that compounded this have created some confusion, fear, and to an extent, I think that's the intent of this announcements, just to really create chaos and confusion. And we want to make sure that to the extent we can, we work with the community to prevent them from disengaging when they have access to these services. So there is a number of actions that expand immigration enforcement, which is the things what we hear first, and again, ensuring that working with our partners, we get information that is correct out to the community. There is, as our friends with public counsel just mentioned, this rescission of long-standing sensitive protected locations policy at the federal level that now is creating a lot of fear. I mean, that includes hospitals, includes courthouses, places that traditionally, at the federal level, they were protected. That is no longer the case. And just like, public counsel was mentioning, in the county, we have our own internal policies that apply to all county departments. In fact, yesterday we trained all departments with county counsel on what those policies are and how they are supposed to ensure that access to county services continue in a way that we abide by those board policies in regard to sensitive locations that are owned, at least controlled by the county, as well as the county position of non-collaboration with immigration enforcement activities. And so as far as the departments are concerned, they received the training, they received instructions as to how to respond, and we will continue to work with specific departments that serve specific populations, for instance, with the housing agencies, including, LASA, including the Housing for Health. And as far as the health providers, we are working with DHS to provide some training for the hospitals, the doctors, nurses, personnel that interact with the public in regard to the county policies and some of the best practices that we see may have a positive impact. Some of the other policies that are not impacting us as directly, but certainly impact the community, is this, securing the border, suspension of refugee admissions, suspending asylum, canceling the application that CBP-1 application that folks used to use to schedule appointments to present themselves to seek asylum and be allowed in, through an orderly process. And now that's all terminated. And some even broader, orders, attempts to tighten up these immigration policies. The end of birthright citizenship was one, that was presented right away. There was some temporary injunction to hold off on that, but those issues continue. The termination of humanitarian parole, and more specifically, the rescission of TPS for Venezuelans, or extensions of the TPS, meaning that once what they have expires, they are not going to be allowed to renew. So that is all impacting the work we do. And here's just a couple of minutes on some of the things we are doing, which I already referred to some of those. So this outreach and education for us and know your rights sort of presentations, us directly presenting and then in partnership with a number of legal service providers that we fund through the Represent LA program. I'm sure some of you know that we fund and administer for the county and the city of LA this Represent LA program designed to provide immigration legal representation to immigrants, both removal defense and affirmative services for those who are eligible for some relief. We have now under contract a total of 13 immigration legal service providers, all of the ones that you generally work with, from public counsel to bed to the more specialized like Chirla, Careza, and many, many others. One of the things that we realize is that working with CDOs is crucial, particularly with what's going on. They are trusted in the community. They have engaged with the community for many, many years and understand how to communicate, how to serve them. So for us, it's very crucial to support them, not just with the resources the county has, but to the extent we can build their capacity through financial support. We have been doing that over the last few months. We have been able to invest a total of $8 million, providing capacity building grants to, so far we have provided 31 agencies, organizations with a grant for them to build their capacity, again, to be better structured and prepared to meet the challenge, including case management. I'm going to wrap it up just by reminding all of you that in times of anxiety, consumer protection becomes more crucial than ever. You heard from our colleagues at DCBA earlier. The one thing I want to remind us again is immigration fraud. As individuals out in the community are trying to protect themselves, they are very susceptible to claims of from individuals, saying that they have the answers, but they know how to get them some legalization processes. And now more than ever is very dangerous to go to a consultant, a notario, paralegal, who is going to take our money, which is not the worst situation, because once they open a case for a type of immigration relief that we're not eligible for, then that is going to expose individuals to some very precarious situation in terms of eventual deportation orders. So we caution consumers to be very careful not to trust notarios, paralegals, immigration consultants. Always go to a licensed attorney, to an organization that is approved by the federal government to provide those services. Otherwise, they can run into some trouble. And so I just wanted to share here quickly a landing page on our website where we have some resources that you may find helpful. We have an events calendar that is quickly filling up with Know Your Rights presentations, again, in partnership with our stakeholders and some that we were doing directly in the community. And the overall materials that we have in development. We are now working to launch a campaign that is going to last at least for the next 6 months, engaging with a PR media firm, the street level strategies, firm that is going to develop. It is already, helping us with the website content, with materials to get out, billboards, buses, the social media, radio, TV, print, in different languages, so that again we get information that is timely and that is accurate, and that we can share with partners for them to send out. We have a regional work group that has been working since November in identifying resources we have collectively, ideas, strategies to share those resources as a group, and the messaging. What do we say to be more effective, and at the same time identify gaps where we need to come up with recommendations or resources to close those needs that folks need. So I'm going to stop here. I'm sure you may have some questions. Here is our contact information. You have my name information. Anytime that we can be of support, please let us know. And we have this is sort of like deja vu, Rosa. I know we were meeting almost weekly back in Rodeo Wine 1.0, and certainly we're here to support each other. And again, really appreciate the opportunity to share these brief comments with you.
Yes, thank you so much, Rigo. We greatly appreciate you coming and joining us today. I know this must be a very busy time for your agency, and obviously there's a lot going on, and I think the story is still unfolding over time. Do we have any questions from the Zoom room or from the audience? Seems like you may have satisfied so many people with the incredible information today. And we're thanking, of course, both our public council presenters, Raymond and Cassidy, as well as Rigo from the Office of Immigrant Affairs. I think the through line from so much of our presentations today is the incredible set of resources we get to benefit from in Los Angeles County that are here to address our most critical and urgent and emergent needs. Again, if there are no questions for any of our presenters, I know we have gone over time today because we had so much information to share with you. But if we are concluded, I will say thank you again to our fabulous presenters, and we'll go ahead and excuse you all and wrap up the meeting very quickly with just a couple of quick announcements. We do have upcoming HICP meetings, first Friday of almost every month. We've moved a couple of them in light of upcoming holidays, but please make sure you are registered to participate in the upcoming meetings throughout the year. We also wanted to make sure everyone was aware that the Health Innovation Community Partnership is out in the community. We are bringing the message of what are the projects happening on the Los Angeles General Medical Center into the community. We've had our events in Lincoln Heights and El Sereno, and then we have events coming up at the LA General Medical Center next week, as well as events in Boyle Heights and Chinatown the final week in February. And then you may have been invited to participate in a listening session related to the Centennial Project next week, and that meeting is being postponed. So it will be rescheduled, and we look forward to sharing that date with you in the future. But these events here, looking ahead, are indeed confirmed, and we invite you to join us. There's flyers, there's a QR code. We'll make sure that gets out to you via the distribution list, and of course, it will be available on our HICPLA.org website. Last final note is February is African American Heritage Month, and there will be celebrations here at the medical center. Next week, there will be an African drummers and dancers on the 12th. And then on the 27th, we will have a celebration with live music, raffles, and presentations and resources. So the entire community is invited to join us for those events coming up. And with that, we will say goodbye. Thank you all for joining us on this rainy Friday in February. Have a wonderful day and weekend ahead, and we look forward to seeing you in March.